Here on Morning Live. Now, the South African Municipal Workers Union, or SAMWU, is calling for greater compliance as COVID-19 has claimed the lives of 63 municipal workers and 4,500 have tested positive. The union is adamant that not all municipalities are compliant with the health and safety regulations and that some of them are still not providing workers with the necessary personal protective equipment. So to discuss this matter further, we're joined by Koena Ramotlou, who is the General Secretary of the South African Municipal Workers Union. Thanks so much for your time. Welcome to Morning Live.
Good morning and good morning to your viewers, Sagina.
Mr. Ramotlou, firstly, what are the working conditions that your members have described on the ground currently?
In fact, the reports we've been receiving from our special NEC indicates that there are municipalities that are complying, but there are those who are generally not doing anything in effort to ensure that they can comply. That's why we had the workers who had succumbed to the COVID, who are 63, and we want to pass condolences to the families and their friends. And as a union, we are very heartfelt about them passing away. And even those that have been infected, we want them to speedily recover so that they can continue to provide a necessary service to the public and carry the country through this difficult time. That's where we are. And as things stand now, in terms of compliance, there is a circular that was issued in the Bargaining Council that compels municipalities to ensure that there is a protocol that must be observed by all municipalities. And this protocol in itself, it is a binding to municipalities to say where they have not been able to comply. We have now engaging with the Department of Labor so that the inspectorate, where there is no compliance, they are able to help us to ensure that they can close up that space until compliance has been observed by the municipalities in different areas. It might be a municipality, but you have different depots where workers are working, where you might go to refuse removal, you might go to a depot in electricity, you might go to a depot of the traffic officers, you might go to an area where you have the ambulances. And we're saying in those areas, we were appealing to municipalities to say if they can't comply, from our side, workers will not be able to take up those services and work going forward. And we think if municipalities don't do that work, it's going to compromise the entire country in terms of flattening the curve on the pandemic.
So when we look at the figures that you have supplied, which categories of municipal workers have been mostly affected, of the ones who are infected and the ones who have passed away?
Our reports that we have, it has comprised of those who are in the community services, those who are your metropolis, the nurses, and the traffic officers, because those are the ones who interact with people consistently on a daily basis in trying to enforce and being able to take care of those who are infected, and also including an element that is in the refuse removal, because remember, the masks that are not washed, that are being disposed of, it's a medical waste. It means our workers in that area are also affected by the same pandemic, therefore. But the majority which we have now, they are in the community services, which include the areas that I've mentioned before.
That's such an interesting point that you made, because the other day, as I was disposing of waste in my own bin, I actually thought about that, with tissues, and I thought, hold up. How do I just throw my tissues away or disposable masks because of this COVID-19 pandemic? And what happens when someone comes to collect this waste? So when you claim that some of these municipalities are not compliant with regard to providing the necessary PPE, why are they not doing it? Because it is clear that there is exposure. And if they are not doing, why is it not happening?
I think first let's deal with the risk that is exposed to workers before we come to where the risk here is that municipal employees who are in the refuse removal section, they need to be protected because they are carrying all type of waste from everything, from every house. And if we don't protect them, if the municipality don't protect them, that exposes them. And it means if they don't come to collect your waste, it exposes you in your own house. Because this virus, we're told it's changing form every time. But at the same time, I think the municipalities are not doing this at some point deliberately because there's not compliance on what is called a protocol, where you have a compliance officer at the depot level before the truck leaves the depot to go and do refuse removal. There is no one who checks temperature. There is no one who ensures that there is enough gloves. But we have in the NEC, in the reports we have received, they indicate that there is general compliance, but we want to emphasize that let's all allow municipal workers to carry the country so that we can survive this pandemic. I think that's our call from our side as SAMU.
And let me just ask you finally, as we end this interview, Mr. Ramotlou, what are some of the interventions that some of these municipalities have implemented that are actually working and that you are satisfied with?
No, in certain areas, I can confirm, Sagina, that there's been compliance with regards to fumigation of the vehicles of, for example, of Metro Police officers, where there might be gaps there and there. There's been fumigation of the trucks that workers are using. But I think lastly, just to confirm to you, is that we're in a process where workers are supposed to get their 6.25 increment on salaries. And we're saying municipalities should not forget, and the reports we have is that the increment is going to come in as confirmed by provinces to say all municipal workers will get their 6.25 as per the agreement that has been signed.
I know I said that was the final one, but real final question now, just with regard to the figures that were released, because the ones that you gave us were on the 7th of this month. What kind of numbers are we seeing now?
We had a special NEC on the 10th of July. The figures that we released were based on the reports that we received in the special NEC that says workers who are affected are 4,571. Those are affected, and those who have succumbed are 63. And the last was to say the workers are going to be receiving their 6.25 salary increment by the end of this month.
Well, Mr. Ramotlou, thanks so much for your time. Koena Ramotlou is the General Secretary of the South African Municipal Workers Union, talking about the number of employees that have been infected and those who have died of the coronavirus so far, and of course talking about some of the conditions that they have to work under, and of course for all of us to really spare a thought, especially with some of the services that we may not pay much attention to, but in the time of coronavirus we should. Let's take a quick break.